Guys. Good afternoon, good evening. That depends on where you are watching me from. This is Nurse Stephanie Peace. Let me wait for a little while for others to come in. Today is Friday. I'm at work, guys. I'm still at work. If you can see from behind, I'm in the office. In case you watched my previous video, I talked about the doctors being on strike, and that has made them to discharge a whole lot of patients in the ward. So right now in my ward, there is no single patient in the ward. We are less busy. Nothing is actually going on. If you are just coming in, give this live stream a thumbs up. Okay, so I will try to make this video snappy, like fast. So the reason for this live, okay, so I'm in the hospital actually. So my ward presently is antenatal ward. So here we deal with pregnant women, breastfeeding women. We have encounter with them on a daily basis. So a woman came to the ward today to complain. She's not pregnant. This particular woman is not pregnant actually. So she was complaining to my colleague, not me, because we share common ward with postnatal. I'm presently in antenatal ward. So since there are no patients in the ward, both of us were together, and the nurse came in to, the patient came in to ask the nurse this question. She asked that is it normal for one of the breasts to be bigger than the other one? And she was very scared because when she came, the way she was feeling, and the nurse was like, are you just realizing it for the first time that one of your boobs is bigger than the other one, so that we'll know what we are telling you? She was like, no, that for long now that she noticed that her right breast is kind of bigger than the left one. So when she was done, then my colleague was like, I have to do a breast self-examination for you. Are you okay with it? Because at this point you have to take off your bra for me to examine your breast to know if there is any form of lump in your breast. She was like, yes, you are a woman like me. I have nothing to be shy about. So my colleague took her to the private room, told her to take off her shirt so that she could examine her. Then she did examination on the boobs, and then nothing wrong happened. So they came out to the nurse's station, and my colleague started giving her health education, and that is the reason why I decided to come and make this live. So it now occurred to me that a lot of women out there are having this doubt why one of their breasts is bigger than the other. They are confused about it. So after all the said and done, nothing was actually wrong with her. And I was like, okay, it's a nice topic to talk on my channel, because I believe since she has that particular doubt, a lot of people out there are going to be having same doubts. So here is me telling you that for one of your boobs to be bigger than the other one, there is absolutely nothing wrong with that. Okay? I will tell you reason why what you should observe in your breast for you to know that something is actually wrong. But for the fact that one of your boobs is bigger than the other one, please, it doesn't mean that something is wrong with you. Okay? So As a woman, normally you have to be examining your breast every month. Every month, like 4 to 5 days after your menstrual cycle, you need to examine your breast to find out if there is any lump there. So I'm telling you that in case you check yourself and you find out that one boobs is bigger than the other, please, there is no cause for alarm. It is normal, okay? And you can even discover that one boobs might like come a little bit down than the other. Like these two boobs now, probably um here is my left and here is my right. You might find out that your right breast is a little bit down than the left one. Please, there is nothing wrong with that. It's actually normal. So there is no cause for alarm. But then, should in case you notice that when you palpate your breast, you notice any lump, any dimpling of the skin. What I mean by dimpling is like it's okay, this is a dimple. Yeah. So you notice that in your boobs is kind of going inside. Please, it is abnormal. It is not normal. Or you find out that when you press your nipple, you find out that probably milk or discharge is coming out of your nipple. Please, it is not normal. If you are not breastfeeding, it is not normal. Please rush to the hospital. And please, it might not be breast cancer, because when you are having mastitis, that is infection of the breast. Of course, water is going to be coming out of your boobs when you press it. So don't think when water comes out of your boobs, it's a sign of cancer. It might be an infection or any hormonal imbalance. Okay? So if you notice you have any form of breast discharge, don't panic yet. Rush to the hospital and for the doctor to detect or check your breast to find out if there is any fluid, abnormal fluid coming out. And then after that, they are going to tell you. Then if it's cancer, they will tell you what to do. And if it's not cancer, they will give you medication to take. Another thing to observe in your boobs is if there is any form of redness. Yes, redness can be normal, because as a woman you might scratch your boobs and then you find out that there is redness in that particular part. That doesn't signify something. It's actually normal. So all you need to do is, when you calm down a little bit, it's going to go back to its normal skin position. Okay. So but then when you find out that that redness is constant, please go see a doctor for him or her to check you properly. Another thing is, when you are checking of the lump, you can also palpate your armpit, your axilla, because the lump can actually be located on your axilla, or rather in your axilla. The lump can be located in your axilla. So going back to what I said, I'm talking about one boobs to be bigger than one is actually normal. There is no cause for alarm. It is normal. Okay, so don't think because of one of your boobs is bigger than the other, you might think it's abnormal. It's not abnormal, it's normal. Don't panic. The only reason why you should panic or why you should visit the hospital, there is breast discharge. You notice that we are having breast discharge because as a normal woman, you have to examine your breast 4 to 5 days every month after your menstruation. You need to examine your breast. So if you are a lady watching me and you don't normally check your breast for any abnormality, you are not doing right at all. You are doing wrong. So if you find out, maybe during the examination, you have to like raise up your hands, then you palpate, and after when you are palpating, you find out any hardness. Normally, we have like lubulis on the breast, so don't think it's that. When you notice this kind of a hard mass, like it will be like a stone, that is a symptom of cancer. It's a lump, sorry. It's a lump, so you have to report to the hospital so they can take it off immediately, because before it turns into something else. Another one I talk about is discharge. When you press your nipple, you find out that discharge are coming out. Okay, the discharge might be a sign of cancer, while it can be a sign of infection. So if you're having discharge, don't think it's cancer. It can be infection also, or hormonal imbalance. And another thing I talk about is if you're having dimpling. which I make example of looking at your face, there is dimple. So if you find out that your breast, like there is a dimple in your breast, please, it's not a good sign. Rush to the hospital for checkup. And you check your armpit and you find out that there is a form of lump, any hardness, please. It is early. It is best that it detects early. Any abnormalities being detected very, very, very much early, and you start treatment than when it's now turned into something bad that will make you to spend a whole lot of money and even end up taking your life. That is when you are going to be scared. But if it's one boobs bigger than the other, or one of your boobs is kind of lesser than the other one, no cause for alarm. Okay, so that will be all for today, guys. In case you have any other question, or you want me to talk about anything on the comment section, I'll be going through the comment section and I will definitely clear every doubt you have. So I have to go now. See you guys in my next live stream.